Now, I got to tell you about stem cells because there's so much stories about all the stem cell treatments and I'm not downplaying them. I'm just saying that my fasting recommendations boosts your stem cell production by your own body more than anything else I know. Tell me one thing that boosts your ability to make stem cells. Nothing. Nothing comes even close to fasting. Now, there are certain foods and there are certain supplements that people can take that on a day-to-day basis increases your stem cell production. Why stem cells so important? For me, it's very important as a cardiologist because there's a thing called vascular endothelial stem cells. These are stem cells that go and repair the blood vessels, the lining of the blood vessels. And I'm interested all about blood vessels, right? Because I think everything in my life revolves around blood vessels. I want my intima to repair itself. And these stem cells come in and they repair the endothelium of the blood vessels. And we know that. And we know there's lots of studies done that when you don't have that progenitor cell production, when it's low, that you get progressive atherosclerosis. Atherosclerosis progressive fast. Because why? Because you don't have the repair mechanisms. You're not making those progenitor cells. Fasting tremendously increases progenitor cell production. We know that. We know that. It's been proven to do that. So I, in my mind, know that my patient who did that 5-day water fast now is repairing his arteries all over his body. And those stem cells know where to go. How do they know where to go? Because the body, when it creates a need, it sends a signal so those stem cells go right there. And they actually, because it's a signal that it sends out so that they hone in onto the right place. Stem cells. See, I can take stem cells right now. I'll give you so many million stem cells. They'll be lost. They don't know where to go. And let's say you had a myocardial infarction. I'm a cardiologist. And the front of the heart is now dead. And I inject stem cells into you. And I hope that they all went in and stayed over there into the anterior wall of your myocardium and started living in there and then started becoming so. Doesn't happen. Doesn't happen. Those studies have been done. I was so disappointed because all my life I've been waiting for something like that. Okay, you have your heart attack, I'm going to inject you with stem cells and your heart is going to come back to normal. It just didn't happen. So those stem cells have to get the right signal. The residence rates need to be just right as well. Fasting increases stem cell production and repairs your endothelium and repairs all the parts of the body that need repair under the conditions of fasting. And those studies have been done in animals, but also in humans. We've seen that stem cells go up tremendously. So I'm very fond of talking about stem cells because, again, look, you, my patient, this is the knowledge I have. And I want to partake this knowledge with you to motivate you to make the lifestyle change you need to make. Take this knowledge, know what it's doing to you, visualize it in your mind's eye, and you will fast not for 5 days, you'll fast for 7 days. That's my goal. That's my goal. When you come back and say, Dr. J, I did 7 days because I felt amazing. That's what I want. And now, there's doctors actually who are advocating 7-day fast for even patients who have cancer, for example, to get rid of cancer cells in the body, because as you know, cancer cells survive mostly in a glycolytic mechanism and environment, and under the conditions of extreme ketosis, those cells die. So many of my, so I've had many patients came to me, they were neither obese, nor were they metabolically really sick. And they said, guide me through a 7-day water fast. I'll do it. Let's do it. I have no problem with that. I have no problem. But I'll make sure that your diet is good. Supplements. After you finish your fast, I'll give you some supplements. But during the fast, I try to keep things very simple. And I usually don't give my supplements, the D3, the K2, and all that, especially if you're doing a short fast. Now, if you're doing months and months, I might give you some D3, K2, omega 3. These are my favorites, right? Vitamin D, so important. K2, so important. Omega 3, I can't tell you how important omega 3 is, right? These are my standard supplements that I give everybody, especially my fasting patients, as soon as they finish the fast, up to and then after the fast. Because I think if I give you fish oil on an empty stomach, you might get some distress and you might get some. So I just keep it very simple. You're fasting, you're fasting. That's it. That's it. Just don't take it. Take it afterwards. And there's enough nutrients in you to get you through the fast. So empowering yourself with that knowledge has helped me to get better results. Jesse, I know I'm telling you all this stuff, but I'm just so excited about fasting. It's wonderful stuff.
Let's come back to stem cells. You got into the importance there. At what point did those come in? How many days into the fast?
They come at the end of your fast. Because the body is trying to survive, and in the survival phase, it's not going to release too many stem cells. Stem cells will come at the time of feeding.
Got it.
Now
You did
that
mention that, but then it sounded like maybe they came in during the fast as well. Talk more about that then.
Yeah. So right as soon as you break your fast, there's a signal that goes. You remember I just said in the beginning, food is not just food. Food is a signaling molecule in your body. It's telling your body how to be. It's changing your physiology. It's telling your hormones what to do. It's telling all the chemicals in your body all over what to do. When you refeed yourself, immediately there's a change in the body. That signal goes to the brain, to the stem cells, and your bone marrow starts pouring out those stem cells at that point. So in the first 24 to 36 hours after you break your fast, there's an outpouring of stem cells that goes throughout the body. Yeah, so most of it occurs at the time that you break your fast. That's when you get it. Now, there may be data to show that this stem cell mobilization later on in a more prolonged fast, so I'm talking about like 18, 20, 30 days, there must be some. And I don't have that data, so I can't tell you. Because I'm sure there's some stem cells being produced later on. But I can tell you this much from the studies that I've read, that when you break your fast at 3, 5, 7 days, you get a surge of stem cells going out. I'm sure there's some that later on as well during your fast. But in the first 5 days, you're not going to see much stem cell production. It's usually at the end of those 5 days. Yeah.
Okay, so you mentioned bone broth, great way to break the fast. We want to ease back into our feeding after that.
Yes.
You also said there are specific supplements and foods to enhance the stem cells in general. So let's talk about that. And then specific foods at the end of the fast during that short period of time where we're going to be producing stem cells, anything we can take in that window to enhance.
So there are certain foods that enhance your stem cell production. In fact, there's some companies that make their supplements out of those particular foods, and then you take that just without fasting, just on a day-to-day basis. And the idea is that you're going to make more stem cells that way. I don't advocate that much. The foods that I do like are, look, vegetables are actually medicines. You got to think of it like that. Look, there's so many million species of vegetables and plants available. But how come we only eat a few of them? Because the rest of them are all poisonous. So they have a chemistry, adverse chemistry. The ones that we do eat can also be adverse to us to some extent. And we do know that there are things that certain plants have a lot of lectins in them, for example. Other plants have certain medicinal properties. So I look at plant food as a medicinal food. The medicinal food that I really love are cruciferous vegetables. Vegetables that have a lot of sulfur in them, for example. So all the broccoli, Brussels sprouts, broccoli sprouts. By the way, broccoli sprouts. All right, let's come back to broccoli sprouts. You want to break your fast? Go and get some broccoli sprouts. So what happens is that they have this thing called sulforaphanes in them. Okay, these sulforaphanes get released into your body, and they stimulate a lot of the enhance the anti-inflammatory responses in the body, and the repair mechanisms and possibly the stem cell mobilization is increased by eating those types of foods.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
The king of all hormesis is fasting. Doing time-restricted feeding on a daily basis should become part of your life. Stop snacking. It's unnatural. You should only have 2 meals a day in a 6-hour interval.